Okay, so
Whenever you're ready.
Oh, good. So first we're going to measure the foot. We always use 2 splints, even though it's called the single piece method. We're going to overlap, and you're going to leave basically a hand over, so about 4 inches from where the plaster meets. So we're not going to tear too much off for Gary, and so we tear off our excess. Now, a quick dip in the warm water. Ooh, you're going to feel good. Critical step. Get most of the water off. Make sure you tilt the plaster because you don't want wet plaster when you go to fold it in and massage the plaster. End up losing too much of the plaster. Just like a fold or accordion in your hand. You're going to cup your hand. Another critical step, you want to make sure you massage the plaster to get it fully activated. You want to get a nice creamy consistency, which we now have. And holding tightly with one hand on the end, fold it. And you want to make a little seam at the top. And we're ready to go on the foot. You always go on lateral first, and we're going to go up high in the lateral malleolus, and then drape the medial side over. Now I'm going to pull the lateral forefoot down because I don't want all the excess plaster up on the forefoot. It makes it more difficult to take off. And at this point, you want to lightly rub the plaster. That's going to activate the plaster so it sets. Then we're going to pull over the medial heel. We're going to pull it over just till it meets and then sweep the tab off the back. That's step 2. And then we're going to lift the medial splint so that we can work the plaster up into the arch. This is step 3. And you need to do this especially with a patient with a higher arch because it's going to tend to pull away if you don't do this. And then the excess plaster always goes up over the toes. And at this point, just rubbing everything to make sure you have no creases, all your plasters activated. Now we're ready to position. My thumb is under the 4th and 5th toes. Now I'm going to palpate neutral. You have the patient relax. Let your foot go. So I'm palpating neutral, and I'm dorsiflexing and suspending just slightly. I'm not actually lifting the leg. I'm just starting to lift the foot. If we were doing first ray repositioning, I would plantar flex at the base of the first met and dorsiflex the hallux, which we don't need to do in this case. Your wrist and arm should be straight in a military salute. Shouldn't be down in, should be out. The foot should be right in the center. And you want to make sure you adjust the chair so that you're not holding the cast too high or too low. You want it to be comfortable for you. And then when you're ready to check to see how well the plaster's setting, you always want to do it up on your folded seam. You don't want to do it on the plantar surface where you can disrupt the cast. And we're about ready. I'm going to give it another probably half minute, and then we'll let it continue to set, and we'll do the other foot. You never had a pair of our custom orthotics, did you? It took you so long. Your first time. Jeez. I'll tell you, when you supply all the materials and you still can't get a pair, that's pretty bad.
It shows that you're in high demand. That's what it shows.
Okay, now make sure you're relaxing. You can see Gary's helping us a little bit here, a little tibialis anterior, but not enough to affect it. But that's what you want to watch for with patients to make sure they're not firing their tibialis anterior and relax. That's good. Now, if you want to pause that, I'll give you a minute and I'll show you the technique.